Welcome to My Bariatric Solutions online guide to eating to succeed with gastric balloon. Throughout this information session, we will discuss the pre- and post-op diet instructions associated with the gastric balloon and help clarify the specific aspects of the diet. Further, we will explore specific nutrition, exercise, and lifestyle tips that will help assist you in achieving optimal results following your procedure. If you have questions after this session, we invite you to write them down and bring them to your next appointment with us. 1 week prior to your procedure, we ask that you start a high-protein, low-carbohydrate, full liquid diet. We suggest you consume 4 to 5 high-protein, low-carbohydrate shakes per day, such as Bariatric Advantage meal replacement shakes or Nectar protein supplements, which are available in office or in our online e-store. Other equivalent protein drinks can be found in most grocery stores, including Premier Protein, EAS Advantage Carb Control Shakes, or Pure Protein drinks. We also ask that you consume at least 64 ounces of water or sugar-free flavored water daily. This includes Crystal Light, broth, Powerade Zero, or any other water-based sugar-free beverage. During this phase of the diet, it is imperative that you stick to the low-carbohydrate protein drinks and water-based sugar-free beverages only. No soups, blended cereals, or puddings are allowed during this phase of the diet. If you are a diabetic, you will need to speak with your primary care physician about adjusting your medications prior to your liquid diet. Failing to do so can potentially lead to severe episodes of low blood sugar, known as hypoglycemia. We suggest taking your patient education handbook with you to your doctor visit, as this handbook contains our recommendations for managing your medications while consuming a liquid diet. If your doctor is unable or unwilling to adjust your diabetic medications during the liquid phase of the diet, please feel free to contact our office and speak with a registered dietitian so they may assist you. You will also need to stop taking all diet pills at least 1 week prior to surgery. If you have any history of chronic kidney disease, then you must contact one of our dietitians before starting your liquid diet to discuss your individual protein needs. Excessive protein intake in a patient with known kidney failure has the potential to worsen kidney function. 1 day prior to your procedure, we ask that you consume only clear liquids, which include water, broth, Crystal Light, Propel, Powerade Zero, and sugar-free Jell-O. It is recommended that you consume a clear liquid protein drink on this day, such as Nectar fruit flavors mixed with water, or any of the Isopure clear liquid protein drinks. Both of these clear liquid protein options are located in our office for your convenience. We ask that you avoid liquids with red or blue dyes the day before your procedure. Do not consume anything after midnight the night prior to your procedure. If you are instructed by your physician to take a medication the morning of your procedure, drink just enough water to swallow the medication. During days 1 through 7 after balloon placement, you will consume a clear liquid diet. You will need to drink liquids throughout the day and avoid all carbonated beverages. Consume 2 to 3 clear liquid protein drinks per day, such as Isopure or Nectar protein powder mixed with water or Crystal Light. If you are unable to tolerate the protein drinks, you can hold off on protein drinks 1 to 4 days following placement and drink only calorie-free water-based beverages. However, reintroduce your protein drinks as soon as the nausea resolves. Your protein goal will be the same as prior to balloon placement, a minimum of 80 grams per day with a fluid goal of 64 ounces a day. You are able to start taking your recommended vitamins after 7 days. Days 8 through 14 after your procedure, you can advance your diet back to full liquids, which means any liquid that is smooth, pourable, and without chunks or lumps. First and foremost, focus on meeting your protein needs using full or clear liquid protein drinks and consuming a minimum of 64 ounces of fluid per day. Once your fluid and protein needs are met, you may also have small amounts of other full liquids, such as cream soups, sugar-free pudding, or Greek yogurt. You are expected to meet your fluid and protein requirements daily. During days 15 through 30 after balloon placement, you are encouraged to introduce soft foods into your diet. You want to start this process slowly and use your best judgment as to what you can consume. You want to eat your proteins first, so that to not fill up with non-protein foods before meeting your protein requirements. You will start to realize which foods you can tolerate and which foods you have trouble with. Each patient is different, and you can always go back to the clear liquid phase or puree foods if you are not feeling ready to introduce solid soft foods. Good foods to start with include grilled or baked fish, such as tilapia, chicken, tuna, or egg salad without any hard chunks of fruits or vegetables, canned fruit, overcooked non-starchy vegetables, or refried beans with low-fat cheese. Starting 30 days after your surgery, you can advance to normal textured foods. Remember, everyone is different, so it is important to listen to your body. If a food is giving you problems, make note of it and try something else. You may be able to introduce that food back into your diet at a later date, or it may be just that that food is no longer tolerated by your body. To succeed with your balloon, you will need to adhere to the following recommendations on a consistent basis. Tip 1. Consume protein every time you eat and always consume your protein first. Protein is the building block of muscle, skin, hair, nails, and organs. It is vital to meet your protein requirements each day to ensure you are healthy after surgery. Adequate protein intake ensures that you lose fat and not muscle, and it also helps keep your metabolism high. For every pound of muscle you lose, you decrease your resting energy output by 10 to 20 calories per day. Protein is also a very satiating food, which simply means it helps to keep you full. In fact, people that consume protein at each meal and snack tend to consume about 400 calories less per day than those who don't. So, by eating protein at each meal, you will be working with your surgery to help you feel more satisfied while consuming fewer calories. Adequate protein intake also helps to maintain a strong immune system, aid in wound healing, and prevent excessive hair loss post-op, which is a common issue after weight loss surgery. After balloon placement, you will fill up after 1 to 2 cups of food. If you eat fruits, vegetables, and carbohydrates first, then you will not have enough room to consume protein. Therefore, you must always consume your high-protein foods first, before consuming anything else, so that you can easily meet your protein needs. Continue to use 1 to 2 protein supplements each day to help you meet your protein goal. Females require a minimum of 60 grams of protein per day with a gastric balloon, while men require a minimum of 80 grams per day. However, rather than striving for minimums, you should strive to meet your optimal level of protein on a daily basis. Your individual protein goal is based on your gender and height. Using the charts shown, find your individualized protein goal. The amount of protein you are consuming from solid animal protein sources can be determined using a simple equation. 1 ounce of animal protein equals 7 grams. So, if you consumed 4 ounces of grilled fish, that would be equivalent to 28 grams of protein. Tip 2. Follow the plate method of eating. You can use the plate method to help you consume the proper ratio of food groups. First, always eat your protein, and then if you are still hungry, focus on non-starchy vegetables or salad. If you are still hungry after that, then top off your meal with healthy complex carbohydrates. Listed are good sources of proteins, non-starchy vegetables, and complex carbohydrates. Tip 3. Eat your calories. The gastric balloon significantly reduces the amount of solid foods your stomach can hold. Solid foods do a great job at filling you up and keeping you full, but liquids do not have that same effect. It is possible to cheat your tool by drinking high-calorie liquids, which will allow your body to consume unnecessary calories without filling up. Avoid or limit high-calorie liquids such as juice, soft drinks, sweet tea, Kool-Aid, sugared coffee drinks, milkshakes, and any other high-sugar, high-calorie liquid. Your liquids need to be water-based and contain no calories or very low calories only. Examples include water, Crystal Light, unsweet or artificially sweetened tea, green tea, Propel, Vitamin Water Zero, and Powerade Zero. 1 to 2 cups per day of sugar-free or artificially sweetened coffee is okay as well. Tip 4. Eat 5 small meals. In order to meet your protein requirements with restricted stomach space, you will have to eat 5 small meals each day, including 3 high-protein meals and 2 high-protein snacks or protein drinks to ensure your nutrition requirements are met. Consider these high-protein snack options: string cheese, cottage cheese, protein bars, protein shakes, hard-boiled eggs, deli meat, reduced calorie peanut butter, and hummus are all great examples. Tip 5. Stay on track. In order to succeed with the gastric balloon, you must attend your follow-up appointments. It is imperative that patients meet with their weight loss management team, including the surgeon, nurse practitioner, exercise specialist, and registered dietitian, throughout the 6 months following balloon placement, as well as the 6 months following balloon removal. Failing to comply with your scheduled follow-up appointments generally leads to poor results. Tip 6. The intake of concentrated sugars and large amounts of fats can inhibit weight loss in balloon patients. To assist with weight loss, all patients should limit high sugar and high fat foods, as well as refined carbohydrates such as white rice, pasta, and bread. These foods can cause GI distress. Tip 8. There are required vitamin and mineral supplements for all weight loss patients. All recommended supplements can be purchased at any of our offices or via our online e-store for your convenience. All patients are required to take a bariatric-specific multivitamin 2 to 3 times daily, 1,200 milligrams of calcium citrate per day, and a sublingual vitamin B12. When taking iron or a multivitamin containing iron, it is important to separate your iron from your calcium supplements by at least 2 hours, as calcium inhibits the absorption of iron. Tip 9. Weight loss surgery alone will not help patients lose weight long term. It is equally important to consume a good diet and to exercise regularly. Tip 10. In addition to your follow-up appointments, we encourage you to attend our support group meetings. We provide a variety of support groups, including online meetings, to help you through every stage of your weight loss. You can find our support group calendar online, or feel free to ask any of our staff members for a copy. Support group meetings are a great way to get the support you need to succeed. And don't forget that you will receive 20% off any in-office supplement orders 30 days following any support group meeting you attend. Start incorporating regular walking into your daily routine for small amounts of time, increasing intensity and duration as you feel better. Your goal is to walk for at least 30 minutes 5 days a week or more. You can start adding resistance training for at least 20 minutes 2 to 3 days a week if you are feeling well enough. Please see our exercise specialist at your pre- and post-op appointments if you would like measurements and body composition testing performed regularly. The best exercise you can do following balloon placement is cardio. Cardio helps keep the heart healthy and prevent many diseases. It also helps with weight loss and weight management. You are better able to control your mood and mental health and your ability to perform certain activities will be much easier if you are adding cardio regularly into your exercise routine. Strength training is also important, as it slows the loss of bone density as you age, builds strong, healthy muscles, keeps your metabolism revved up, and helps with long-term weight loss and weight management. Start introducing resistance training and continue performing these important exercises for life. Ideally, a good exercise program consists of half cardio and half strength training. Flexibility training benefits your range of motion, improves performance of various activities, and reduces your risk for injury. Try incorporating stretching into your regular exercise routine to maximize your chance at long-term weight loss success. Thank you for watching My Bariatric Solutions, Eating to Succeed with Gastric Balloon. Please answer the following quiz questions.